First, let me just ask, has everybody left contact information to follow up? Because we should have some sign-up lists outside, if not. And also, I know there were a number of addresses and resources that were discussed. So if people want to maybe we can make a list. And you know, if someone has a website or a source or something that was referred to, we can make sure that that comes back.
I think everybody who registered here, we have their contact information because we've been communicating with them through FEI now.
Just asking. You know, when this started, of course, we didn't know who was going to come. And I think some of us had a concern that, at least from New York, Connecticut, Massachusetts, that this was going to be a Northwest event, and we'd be kind of spectators. But I'm really have not had that sense of it at all. This has really been very much a common event, even though we have different systems and some dissimilarities. I've been really struck with the with really the commonality and the broader sense of overarching interests, which are truly regional and national. You know, in summing up meetings, there's two things that really irritate me when someone sums up a meeting, and it's not talking too long, because I won't do that. But there's two chalk on the on the blackboard statements that I really can't stand, and one of this is I'm deeply humbled by everything I've heard today. The second one is, let me tell you what I've learned today. So I won't do either of those two things. What I do appreciate is I do feel quite respectful of what's been said, and I think it makes me aware of the things we do well and the things we don't do well, and the things which are really gaps and absences, and that's one of the real values of this kind of interaction. I think the other thing I wanted to say is one thing that really strikes me, and I think it struck many of us who come into this as investigators, in really coming out more of a university context or even federal agency context, and that is that, you know, we're dealing in an environment of the harshness and the anti-humanity or non-humanity, which runs across every theme. At the same time, I think of all the working groups we work with, we see as much investment here in the sort of health of the workforce, trying to make the lives of the professional staff humane, and trying to reach out to really great personal pressures, family issues. Not that there aren't many problems, but we do see a very, I would say, a very humane phenomena in an anti-human, what may seem like a very anti-human or anti-humane environment. I sometimes wish we had the same level of cooperation in private industry, like I said this morning, which we often don't. But it's really a comment about what's here. The other thing that I really quite appreciate is, I mean, we make a big point about teamwork and participatory work, certainly at CPH New and all the groups here do. This has been a very good meeting from that point of view. I really feel very strongly that everyone who's come here has approached this from, I'll say, I used to hate this word, but professional point of view. People understand their work, they understand what they have to do, need to do, and they're more than willing to cross across traditional institutional barriers, be they public sector, corrections work, university. It's very easy to have natural barriers, and I think there's clearly both a respect and an interest in problem solving, which comes off very loud and clear at this meeting, which makes me feel optimistic about the future. I mean, several things I want to say that I think also struck me. One is that I said this early on, and there was only more evidence if we think about the talks of this morning. There's been some very good work going on, and a very high level of cooperation. And although it may seem thin, I wouldn't say that's true for all fields. Often we have many people competing, and certainly in the academic realm and health promotion realm, with some real, some substance and a lot of trash. And there hasn't been any trash talk. I mean, this has been very much to the point. And what it really also says that I think small groups of the institutes, professionals in the workforce, academics, not only can work together, but quality pilots are really what's very important. We have to do the work that we do very well. It has to be convincing. We have to be able to make the arguments, in the broader arena. What I find promising is that there's work going on, as we've seen here, that I really quite appreciate and see the value. It's as I said, there are things that we do not do well that we've seen here today, and we can learn from them. And we do have some things we do well, which we'll be glad to distribute on. I think the other issue that came up, which was interesting today, is everyone recognized the fiscal limitations and the budgetary limitations and the concrete barriers that people run across time and time again with good ideas. And yet I've never had a sense that people were fixated or stuck on that. There was not the sense of, well, we can't do anything because the dollars just aren't there. All that's true, but there was an interest in problem solving and making the case and developing the evidence, and really at each one of our levels with results trying to push them and have some effectiveness with it. And it does make differences when in fact we have that kind of evidence. I think the other thing I was again very struck with is something that many people have come to a conclusion on. There's an interest in starting early at the academy level and doing programs and training that begins really at the point of induction, involving experienced officers in that process, not separating out the training process from the later assignment, even though there is that real division between training and final facility assignment. And I think that's a very common sense. And I liked John Violante's comment that, which seems evident every day, that not just in corrections, everywhere, leadership cares, managers manage and say that they care. It's, in this environment, it's very clear it's what people really value. So I think the other thing that comes across very much, and I have to say, for those of us who come out of an occupational health background, who've kind of moved into the integrated total worker health background, not from a health promotion perspective, but from a workplace safety and health perspective, which is where we start out. And I realize not everyone comes to that position. It's important to us, and in some ways a kind of relief, and I won't say a pleasure, but certainly a relief, not to hear isolated discussions about health promotion which completely divorced from all the rest of working life and everything else. That there's an innate understanding that you have to deal with individual levels, work levels, organizational levels, and they have to be on at the same time. It's not simple from an academic point of view because they have to be sorted out and studied individually for effect. But there's certainly in this room, there's been an implicit understanding of that all day. And we have not had to have the argument about health promotion and what's, is it work, is it not work, is it detracting from work, is it not detracting from work? That hasn't come up, and it's a relief not to have that debate because it's obvious to people. So I'm going to finish with that and say, again, it's been a delight being here. Appreciate all the work that went on in putting it together. You've been great hosts, and we'll all be in touch.
Again, thank you so much for everyone's participation. You made this conference. I think we're all energized and excited about what's ahead, and so thank you everyone who's traveled such distance for this and to make this just one-day seminar a highlight and what I believe is the beginning of a new direction to improve the health and safety, protect and health promotion for our correction staff. If you could fill out this evaluation, I have pens if you need pens, and all of these are on the table. So secondly, each one has been sent a master list from Adriana already. You just sent that out, so we don't have to hear complaints about that. You've also been sent an evaluation if you choose not to fill one out now that you can electronically. So the great thing about this conference, this was a green conference. We tried to make it as paperless as possible. Everything was done electronically, at least the majority. So thank you to Adriana and Carol. Awesome job, Adriana, our organizer. Thank you for Dr. Cherniak and Dr. Mazen, for coordinating this conference along with Oregon and, again, our sponsors. So thank you so much. have a safe trip, and we will be emailing about our next, the white paper that comes from this, the summary, and future directions. We'll make sure each one of you get an email, and look forward to your contribution of this consortium, continued involvement as we work together to improve the health and safety of COs. Thank you.